So let's talk about top priorities for ACOs. What are ACOs looking for? What are they interested in? What are they focused on? And how does that impact you? We did a lot of market research, right? Really talked to a number of ACOs across the spectrum, all in all to say that we really took a very broad approach to understanding what is an ACO, what are they looking for, how do they want to grow, what's of interest to them, and how does the post-acute care fit into that mix as well. So you see here the priorities that they're focused on, right? So the top two priorities essentially are managing quality and managing cost. Now, that doesn't mean everything else is lower priority. It's just that that's the initial focus. And as ACOs mature, they start looking at some of these other priorities as well. And so you'll see that SNF utilization, post-acute care, those types of things are other priorities listed in the top three, and definitely of interest to ACOs. So, some of the questions we hear or we've seen, what are ACOs actually measuring? What are they interested in? What are they focused on? And so you have some of these key metrics over here. We started that research with Levitt's accountable care learning, collaborative feedback. We did a lot of market research with the ACOs as we talked about, and some of the key metrics essentially came out to be, what is the cost? What is the per member per month cost? What is the per member per year cost? How are those things trending? What is the risk breakout of my population, right? Do I have a high risk population? Do I have a low risk population? What are my readmit rates? What are my ED OBS visits rates? What are my inpatient admissions? What are my SNF admissions? What are my network leakage? How many people are going in versus out of my ACO network, right? So there's a lot of metrics, and then what we're doing beyond that is actually drilling down to the provider level within the ACO for these metrics, right? So what we're showing here is at the ACO level. So now I know how my ACO is performing. I can actually compare that to other ACOs. I can look at CMS benchmarks. I can look at benchmarks that I set myself, and then compare and watch my trends, right? Progress over time. So this is understanding a little bit more about cost. What are ACOs interested in when they look at cost? And when we say cost, what does cost mean, right? So ACOs typically are paid PMPM, right, per member per month. And so they're looking to keep their cost as low as possible below that value in order to increase their shared savings. So one of the things that ACOs are looking at is how are my costs trending, not only month to month to identify how am I doing seasonally, but also year on year, right? So is June typically a high cost month for me? Can I manage that better, or is it normal? So we have year-on-year comparisons. We also are able to, based on the CMS benchmark, identify how we're tracking against that benchmark. And you'll see down below in the grid, we actually capture a number of metrics related to cost, right? So now we're breaking it up by the providers within the network. Okay? So not only do we know the cost PMPM at the ACO level, but we're also looking at it by providers. Now we can see who are our high cost versus low cost, who are providers managing higher risk patients versus lower risk patients, who are managing more patients versus fewer patients, right? So we have a much better understanding of what our patient mix is, what our cost makeup is. The interesting thing here on this slide is we're looking at patient pathways. So what we're trying to do, what we actually do here is understand, okay, where are my patients coming from? Where are they going? How many are going, for example, from hospital? Where are they going? Are they going to SNFs? Are they going to home health? Are they going home? What's the makeup of that population and who's managing those patients, right? And then even from let's say they end up in a SNF or home health situation, do they come from the ED? Do they go back to the ED? So we get a better understanding of where patients are going, what facilities they're using as well, right? So If you're a post-acute care facility, you can actually see within the ACO, is my facility being used at all? If it is it being used heavily? Do I have opportunity for growth there? Okay, so plenty of opportunities to see, really understand where are these patients traversing the healthcare system.